Hey, good morning, folks. I'm Robert Wolf, and this is the Heartland Report. And today we're talking about something that cuts right to the bone of rural life, the crisis in primary care across the Heartland. A new study from the Commonwealth Fund lays out the reality for more than 60 million people living in rural America, and it's a picture we can't afford to ignore. And I will include some links to the Commonwealth report in the message. But I want to start out with some of the things that they mention, and it's a shrinking workforce creates a growing need. By 2037, rural America is projected to have only about 68% of the primary care doctors it needs for the nearly 43 million people already living in areas that are short for primary care. In some counties, one doctor is trying to care for nearly 3,000 patients, and it makes me think of that line from the John Mellencamp, John Cougar song "Pink Houses" about what we're told growing up. It says he had that line, because they told me when I was younger, boy, you're going to be president. Does anybody tell their children stuff like that anymore? You could grow up to be the president. Or have we all kind of started to realize that no, unless you're born at a certain level, the chance of you ever obtaining something like that just isn't there anymore. But they told me when I was younger, boy, you're going to be president. And that line really is about the exceptions, the promises we think the country made to us. For rural Americans, one of those promises has always been access to some basic care and a doctor nearby, someone you can trust, someone who knows your family. But that promise is slipping away. And in rural communities, the gap's getting stretched pretty thin. We're using nurse practitioners and physician's assistants and community health workers are stepping up because that's what you do. You step up for your community, like we've never had to do before. But the local programs, whether you're in Kentucky or Pennsylvania, they're doing incredible work, but they're just not keeping up for rural providers. And the strain is real. These folks are doing everything they can. Good people doing everything they can. They just need some extra help. And again, I'm gonna go ahead and quote Pink Houses again because as he says, the simple man, he plays the bills, the thrills. So because the simple man baby pays the thrills, the bills, the pills that kills. Rural communities always find a way to show up for themselves, for their neighbors. But right now, the simple man, the farmer, the teacher, the rancher, the factory worker, he's the one paying the price for a system stretched to its breaking point. And the reality is, states can't do it. Federal help is what needs to be done. Congress has set aside $50 billion through the Rural Health Transformation Program, a massive opportunity. But that's still about $100 billion less than in previous years. States can use it to help rebuild clinics, expand the health care system, telehealth, strengthen training, and support chronic care. But the same legislation could also cut rural hospitals, cut their revenue by far, moreover, than they have in decades. And so the gains from that 50 billion are not really gains because it's actually a loss of closer to 100 billion. And this is the crossroads moment for people in the rural areas. When you have a county that has 1 million people in it and a high population density versus a county that has a extremely small population and a very low population density, that may be great for not having to deal with a neighbor because he's a mile down the road, but it limits that opportunity and that ability, and that's got to be leveled out. We have to kind of work on that balancing of need for those people. Sometimes that means that the federal government's got to get involved and spend a little bit more money than that neighborhood or that county can truly afford to spend on its own. When primary care fails, people pay the price. Rural families feel the consequences every day. More ER visits for basic needs because you don't have a primary care physician around. Fewer same-day appointments, so hopefully you can schedule your accident in advance, because I know we can all do that, right? We can all schedule our accidents and mistakes in advance. So fewer same-day appointments and unused telehealth because the broadband isn't really reliable. And long drives when hospitals close and it becomes 90 minutes to the nearest hospital. Hope you don't have a real problem, because that stroke, that heart attack, those real difficult issues, instead of calling the ambulance, you might as just, call the cemetery. And I don't think we want to be in that position. We've worked too hard to not be in that position. But we've been told that that's where we're going to go back. And I don't think most rural Americans, or even people in the suburban or urban areas, want that to go on for their neighbor. Yeah, you might want to say that my neighbor's only the rural person, or my neighbor's only the suburban or urban person. It's not everybody. I'm a citizen of Missouri, and Maine is not my neighbor. But yes, it is, because we all joined together. We all came together long ago, before most of us were born, except for maybe Alaska or Hawaii. But that's a different story. And again, then it kind of come back to old Johnny Cougar, and you hear the pride and the pain when he says, "Oh, but ain't that America for you and me?" We love this place. Whether you live in an urban area or a rural area, it doesn't matter. You love this place. May not be perfect. You may want to make some changes, but don't go saying that the other person isn't a patriot, because they are. We just got to work together. There are people who maybe aren't patriots, but we all know who they are because they're more concerned about themselves than the country. And maybe we need a little bit more we in our conversations than me's, but that's just me. So rural America deserves more than just a shrug and a slogan, and that's what you get from leadership that's bad. And currently our leadership, that's about all you're going to get, is a with a face and then some silly statement that we all know doesn't apply to our neighbors, even if we disagree with them. Most people in this country are good people. So, the path forward. Solutions are clear. We need fair payment models for rural clinics. We need loan forgiveness for rural medical training. And we need real broadband investments. And yeah, you know what? He gave a little bit of broadband investment into West Virginia, and they're touting it. But that is stuff that had already been planned under the Infrastructure Act under Biden, things that he had canceled back in February. So you got to think about that. When you cancel something from the previous president, and then a few months later you approve it under your own name, who are you trying to fool? Who are you trying to fool? We need community health workers on the ground, in the areas. We know what works. We all do. We know what works. We just need the will to fund it and keep funding it, because it's not as much of an expense as it is an investment in our country. in our people, in our society. It's what our great-grandparents knew. Coming out of World War II, coming out of the Depression, spend the money to invest in the United States and it will make life better for everybody. And then somewhere in the 1980s, the silent generation and the baby boom generation decided it was more about me than we. We gotta flip that script. So, my closing words, when you listen to Pink Houses, it's really not about the houses at all. It's about the gap between the American promise and the American reality, especially for the working people. And Mellencamp ends that song with the bitter truth. And the saying is, but just like everything else, those old crazy dreams just kind of came and went. Rural America's held on to big dreams, strong towns, local schools, thriving clinics, neighbors caring for neighbors, but it's failing. So we need to kind of change the plan, flip the script. Those dreams don't have to come and go. Not if we fight for them. Not if we invest in them. Not if we insist that every community, big or small, rich or poor, rural or urban, deserves a fair shot at staying healthy and having a middle-class life. All right, I'm Robert Wolf, and this is the Heartland Report, commonly known as my soapbox. So, but ain't this America? It's time we make it live up to that promise. And make it a little better for you and me. All right. You have yourselves a wonderful day. And again, I'm going to attach the Commonwealth report to this. It's a lot of information, but take the time to look at it and think about it because, again, like I said, some people are talking about, oh, well, we're going to put $50 billion in rural investment, but we used to be putting $150 billion. So it's not giving us a lot of money. It's actually making us do with less. And it's not the average man, it's not the poor man who needs to step up to the plate. It is the idea of not being able to have a true progressive taxation because you can't tax wealth, you can only tax income. We might need to rethink how we allow people to get paid in equity over income. That way we can actually start investing in the United States of America again. Make it better for the next generation. If we can't make it better for you and me, maybe we can at least make it better for them. All right. Have a wonderful day.